Alright, so let us begin with day 33 of Alan Skinot's study streak. And just let me adjust you. Yeah. And we have covered around 100 or 100 plus, more than 100 remedies in the last 32 days. And today is the 33rd day. So, majority of the remedies are covered, and those who are joining late, those who are tuning in late, they can go through the previous lectures in Instagram, YouTube, or Spotify, and you will be able to find in Spotify. In fact, it is more convenient because you can switch off and just listen to the audio. So, there are many nitty gritty things that I have shared from the Allen's keynotes which I have usually taken. So let's cover today the Allen's Tuberculinum from Allen's keynotes. And in Allen's keynotes, actually, there is Tuberculinum, and then with it, there is a mention that it's also Bacillinum mentioned with it. But there is a separate section where Bacillinum is mentioned separately. So there are some minor differences, and actually, if we go to see, there are around 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10 compounds of tuberculinum, or 10 varieties of 10 tuberculinum sources which in homeopathy are being used for preparation of medicine. Whereas for bacillinum there are just two sources. So the difference is that in tuberculinum, which is the main remedy, tuberculinum, just tuberculinum, it is prepared from uh, the tubercular abscess, the pus from the tubercular abscess. So it is a diseased organ, and once you use the diseased organ, it has those qualities of the diseased part, the entire pathophysiology, and the structure, and how it is going to mimic similarly in our clinical practice when patients report to us. So those things are very similar. If you see tuberculinum, it is pus with bacilli from the tubercular abscess, whereas bacillinum is the entire tuberculous lung. It is the maceration of the entire tuberculous lung. So bacillinum would be kind of a whole organ or whole lung which is used, and tuberculinum is pus with the bacilli of the tubercular abscess. And then there are some other tubercular varieties which are tuberculinum denis, Koch, and Lyricus, and all the smaller things which probably we'll keep it from for some other time when we do a comparative study of the different remedies. So right now let's proceed with tuberculinum. When with a family history of tubercular affections, the best selected remedy fails to relieve or permanently improve without reference to the name of the disease. So whatever be the name of the disease, if the patient has got stuck up and if he has the features which have been described in the following lines, then tuberculinum can be indicated. Now what are the conditions and what can be the constitution, mental journals and physical journals? We come to it. So it's mentioned that it is adapted to persons of light complexion, blue eyes, blonde, in preference to brunette, tall, slim, flat, narrow chest. And then the next line says that it is also adapted to someone who is active and precocious mentally but weak physically, and they are tubercular diathesis. So tubercular diathesis, if we read from all the different books, we see that there is kind of a restless behavior and trying to achieve something with lot of inquisitiveness. That is actually what would qualify as a tubercular person. Tubercular diathesis would mean that the body or the organ or the entire constitution physically is disposed to act in a way where there is hyperactivity. Either it can be of a part or the whole organ, and it can be someone who is physically weak and mentally very strong, very active. So you can understand that it has effects on the physical body more, and someone who is having disease more on the physical body, but the mind is very strong, very active, and you can see that the person, it can be child or a grown up adult, who is very active, very sharp, and very focused, and they are in good jobs where they require a lot of mental stamina to perform their work, but physically they are very weak and they have never been putting on weight. They are getting infections on and off, and it can be a lot of things that are happening to them on the physical body, but mentally they are very sharp. So this is going to be your understanding of tubercular persons. And if you read in the mental journals, you see that there is melancholy, despondent, morose, irritable, fretful, peevish, taciturn, sulky, naturally of a sweet disposition, now on the borderline of insanity. So, someone who is calm and controlled in his senses, but he is about to get out of control, or he is bordering on someone who can go out of control. And you have the features of the other remedies, some parts of chamomilla, some parts of antidote, some parts of sulfur, some parts of you know fretful, peevishness, taciturn, sulky. All those things are more there. So yeah, Dr. Priyanka Madan is telling that it is similar to lycopodium, mentally and strong, physically weak. Yes, very true. But the seat of affection for lycopodium would mostly be gastrointestinal or upper respiratory, whereas tuberculinum would more suit to the lower respiratory tract and the lymphatic areas, and you can say the entire constitution. For that, you will have to differentiate using physical generals and physical particulars, if at all there is a very close running competition between both the remedies in your analysis. So next we have everything in the room, which is very strange, as though in a strange place. Symptoms ever changing of ailments affecting one organ and then the other, suppose lungs, brain, kidney, liver, stomach, nervous system, and something that begins suddenly and ends suddenly. So you have patients who develop multiple organ pathologies, and they have been suffering and their organs have been toiling since a long time. In those cases we can think of tuberculinum, provided they are sharp mentally, they are not getting dull, and also their physical body has become weak, diametrically opposite to the activity of the mind which is going on. Next is, which is a very valuable tool in clinical practice, and this is, I would say, the bread and butter, which is that tuberculinum takes colds easily without knowing how or where. So yesterday he was fine, and today he lands up with a bad cold and some sort of a chest, infection or accumulation in the chest. The rapidity would lead you prescribe tuberculinum. Although in the first day to prescribe tuberculinum as an acute would little bit be risky, but you can give some acute remedy and then follow it up with tuberculinum after a few hours, and that may probably help. I have mostly done such scenarios, I have handled where something acute has happened and you seem to know the constitution of the patient because he has been your patient, or you get to know from close understanding in the clinic when he is arrived. You give the acute medicine and then immediately follow it up with chronic medicine or a few doses of chronic medicine, and you may probably prevent a recurrence, or the cure is faster in those cases. So this is similar scenario for tuberculinum like in the case of hepar sulf. In fact, it is also there in sorinum, where one day they are fine and the other day the complaint starts. So good and bad states alternate, which we also see in Fatak repertory as the chief rubric for sorinum. But for tuberculinum, it is mostly that suddenly something has happened and few minutes ago or hours ago everything was suddenly fine. Next we have emaciation, which is rapid and pronounced, losing flesh while eating well. Children and adults who don't put on weight in spite of having all the tonics, all the required nutrients, but they are not putting on weight, they can require tuberculinum. Other remedies are abrotinum, calcarea carb, conium, iodum, and natramine. Then you have headache, which is chronic. Tubercular pain is intense, sharp cutting from above the right eye to the occiput. So you have similar opposite feature, but in sanguinaria. Then you have nux vomica, which also has the pain in the forehead, also in the occiput. Then you have the left side, which is mostly for spigelia. So if you know these remedies well in your practice, if you know that these are the key indications for some remedies, you will reach to your remedy quicker. And this is what Allen's Keynotes does for you. It helps you reach to the patient's remedy with the help of physical generals and particulars very quickly. So you need to memorize it, and maybe this can be a valuable tool to differentiate the remedies very quickly. So you have something that is some patient who is having pain in the right eye radiating to the occiput, that would call for thinking about tuberculinum as one of the remedies. The sensation is as of a iron hoop around the head, so something is held in an iron. Other remedies being anacardium, sulfur, and when the best selected remedy has only palliated. So all those cases of migraine which we think are going well but have got stuck up, there is status quo, they are not improving. If a close introspection from the diathesis and the family history is sought for, you will think of prescribing tuberculinum as one of the top remedies. Schoolgirls' headache, aggravated by study or even slightest mental exertion, when using ice in close work or when glasses fail to relieve, and they have a tubercular tendency. Acute basilar or cerebral meningitis with threatened effusion, nocturnal hallucinations, wakes from sleep, frightened, screaming when APS, Helleborus or sulfur, though well selected remedies, fail to improve. So you see, this has come the third or the fourth time where you see that some remedies have stopped working or not working, and then you think of tuberculinum. So it's probably the best condition where maybe 2 or 3 times you have given some medicine and nothing is working out, a dose or two of tuberculinum, and then again the remedy which is indicated based upon the chief complaints you can give, and you will see that things are set all right, because that miasmatic block was stopping for cure to progress, and that is what tuberculinum will do. So there is some brain pathology. Very few homeopaths will be able to get this as a clinical presentation of cerebral and basilar meningitis, but if you do, think of these remedies, and especially after APS, Helleborus or sulfur has failed, you can get tuberculinum, which is closely indicated. Then you have something about the hair fall. Many homeopaths have been treating, and fairly good success everyone has, and that is the the poster indication for homeopathic announcements everywhere, which is hair fall or plica polonica. And I usually don't tend to call for more attention to these type of cases, but if you have ability to deal with it, you can give tuberculinum in cases where you have given borax or sorinum and have failed. Crops of small boils, intensely painful, successively appearing in the nose, green and fetid pus, like the remedy Sickelcore. So something that happens in successive orders and gets worse with every other occurrence, you can think of tuberculinum. Similar presentation in the skin we saw for graphitis and heparsal, where succession of boils was disrupting the skin physiology. In the respiratory system, you have tubercular deposits begin in the apex of the lungs, usually the left side, like phosphorus, sulfur and theridion. Now, if you are a good clinical prescriber, you will be able to find out if something is trying to accumulate in the chest and you are picking it up from your auscultation. Few weeks ago, or I think a couple of months back, I did some I used to do these post OPD clinical case experiences from my clinic, which I have shared one of those cases where something I picked up on auscultation, and I have put the follow-ups also in subsequent days. If you want, you can go on to the timeline of my Instagram page and you will be able to find it. It's interning online. Many of you are watching right now. So those who are on YouTube, you can go back to Instagram if you can and if you wish to see, and you will find it somewhere down the line in the timeline where I have shared clinical case experiences from the day's OPD and certain cases where I had given another remedy, not this remedy, but it was picked up in this way by clinical examination, which is what very few homeopaths actually look into, and if they do look into, they fail to perceive what is to be done and how it is to be done. So those are smaller things, and maybe in future I will come up with a workshop where we will be combining clinical examination and how will you perceive, how a homeopath should perceive in the practice. So that can be a good possibility for future workshops. Then you have in gastrointestinal system, which is diarrhea, early morning, sudden imperative like sulfur, emanating though eating well, like the remedies iodine, natriumur. Stool is dark, brown, watery, offensive, discharge with great force, great weakness, and there is profuse night sweats. Menses are too early, too profuse, too long lasting, tardy in starting, with frightful dysmenorrhea in patients with a tuberculous history. So it's very well evident and need not explain further. In skin complaints, eczema, tubercular over the entire body, itching is very intense and mostly at night. So all those cases which don't improve, although your sulfur or merc sol is very well indicated and you think that this remedy should work but it's seemingly not working, give a dose or two of tuberculinum, maybe 1 m potency for 1 day or 2 days, twice a day, and then you will see that maybe the earlier remedy has started working, or you repeat the earlier remedy and you will see the changes. Again, you have similar modalities like those of sulfur over here, from aggravated from bathing, aggravated at night when undressing, and there are white bran-like scales which are falling. There is some eruptions behind the ears. Behind the ear eruptions we also saw in sanicula, although the remedy is not mentioned here. So one of the top remedies for skin prescriptions, we should also think of sanicula apart from graphitis, hepar, merc sol or sulfur. Then we have some eruptions in the hair, in the folds of the skin with rawness, soreness, and there is fiery red skin and there is ringworm. And then you see the complementary relationship with sorinum and sulfur. So all those cases where you see that sorinum, some symptoms of sorinum are coming, some symptoms of sulfur are coming, and you are not able to decide or you are confused between the two, in those cases tuberculinum will come of help. Give a dose or two and wait for 15-20 days and maybe things will iron out towards one of the remedies. This is how you should pick up complementary relationships. The other way is, of course, you can use it as a follow-up remedy, or if the earlier remedy is given, then you can use this as a follow-up remedy. So that's all about tuberculinum. And then you also have something which is indicated for the acute stages, which is belladonna, just like we have in Calcarea. So this is for acute indications, and if tubercular patients who are not improving, especially those with tuberculosis as a disease, actually they will require hydroxys mother tincture, and in those cases you can apply it. So next we come to a small section which is mentioned in the end, which has small remedies, especially 10 or 12 remedies, out of which bacillinum is one of the remedies in Allen's keynotes. And if you read, there is mentioned that it is maceration of a typical tuberculous lung, whereas in the earlier tuberculinum which we read, it was actually a certain abscess which was the only a part of the entire lung which was picked up. Both have nearly the similar symptoms. Some have plus symptoms, some have some symptoms less or additional, but that's what we can study them together and apply them wherever need be. For Bacillinum, we have taciturn, sulky, snappish, fretty, irritable, morose, depressed, melancholy, even to insanity. This is very much similar to what we read in Tuberculinum. There is fretful, ailing, and whines and complaints. Mind given to be particularly frightened to the dogs. And then we have severe headache, deep in recurring from time to time, compelling quiet fixedness, aggravated by shaking head. So all those cases of bad migraine which are not improving, they would probably need a dose or two of tuberculinum or bacillinum, which would little kind of push the case towards cure and give you the indicated remedy very clearly visible. Terrible pain in the head as of a tight hoop of iron around it, trembling of the hand, sensation of damp clothes on the spine, absolute sleeplessness. So children who don't sleep or they are not good at sleeping early, they would probably need a dose or two of bacillinum to straighten their sleep cycle. Then you have alopecia areata, a top remedy which you can give for uh, alopecia areata is bacillinum, or you should give it in the highest potency possible. And if you don't seem that bacillinum is not the constitution of this patient, there is no tubercular history, but these traits, if you read Burnett, you will find that these traits of having loss of hair in some parts or having ringworm have a tubercular parentage somewhere in their generations, and that is why you need to give bacillinum as intercurrent, and that intercurrent cannot be just one time but every few months. It can be every 15 days one dose or twice a day dose for 2 days, and then follow it up with the constitutional medicine. The more you find that the case is stuck up, you will need to keep on repeating the intercurrent medicines. This is how a cure happens. There are classical method prescribers who will tell you that one dose and it's enough. I had given one dose in say 5 years back, 7 years back, and that has done the magic. You can try it out at your own clinics and find out if that works well for you. It's good. But nowadays, especially post COVID, diseases need a push to exit from the body, and in those cases, you will need to frequently repeat the constitution or the intercurrent remedy again and again to achieve a greater and faster healing towards positivity. Next, you have eczematous condition of the eyelids especially. So, as I told you, Burnett has given a very extensive, detailed monologue on bacillinum specifically. In fact, the remedy itself is called as bacillinum Burnett. So, he tends to give this more often than the tuberculinum, and the reason was that he found good success with it in cases of ringworm, which he found that they were more of a tubercular history or they seem to be indicative of tubercular diathesis. And that is why eczema, ringworm, alopecia areata, you should give a dose or two of bacillinum to push them forwards. Next you have is indolent angry pimples on the left cheek, especially the left side, breaking out from time to time and persisting for many weeks. Grinds the teeth in sleep, imperfectly developed teeth. Now there are some symptoms mentioned in the Materia Medica, but these symptoms go in the repertory in another form. How will you understand that? By studying the Materia Medica closely and by going to the repertory and studying the remedy wherever it is present. So what we have is imperfectly developed teeth goes in the repertory as serrated teeth, or some teeth which are not in linear fashion, they are in an irregular shape, and that is what serrated teeth means all in the repertory. It has many of the nosodes and a snake remedy and a metal. Bacillinum, medorinum, tuberculinum are the top remedies in serrated teeth. Lachesis and plumbum are the other two remedies. And the latest repertories do have more number of remedies from their own way of eliciting the sources, but take it with a pinch of salt and then verify the sources and then you prescribe based upon those rubrics. Next we have is hard cough, shaking the patient more during the sleep, and it did not waken him. Single cough from rising in the bed, on rising from the bed, especially in the morning, and cough which wakes him in the night with easy expectoration. Sharp pain in the precordial region, arresting breathing. Very sharp pain in the left scapula, aggravated by lying down in the bed at night, better by warmth. Windy dyspepsia with pinching pains under the right side of the ribs in the mammary line. And then you have the fever related symptoms: fever, emaciation, abdominal pains, discomfort, restless at night, glands of both groins enlarged and indurated, cries out in sleep, and strawberry tongue. Tabes mesenterica, talks in sleep, grinds the teeth, appetite poor, hands blue, indurated and palpable glands everywhere, drum, belly, spleen bulging out. So, in the remedy Medorinum, we discussed that children who have psychosomatic complaints, you should think of Medorinum, and that is very strongly positively indicated, because the pains that they assume to happen to them with the mesenteric glands, or you see cases of patients with sonography showing you that there are some lymph nodes enlarged in the abdomen, mesenteric glands are enlarged in the abdomen. They will need these remedies as intercurrents or maybe as a constitutional remedy. It can be Medorinum, it can be Tuberculinum, it can be Bacillinum, it can be any other nosode. So these nosodes will push, and actually if you go and analyze, the nosodes are from the disease product, and that is why in cases of lymph node enlargements, in cases of these swelling of the glands, nosodes will serve best to drain the lymph nodes to eradicate the disease. That is why you should think of these nosodes, and these are the indications for bacillinum which we read from Allen's keynotes. Further, we have inguinal glands which are indurated, visible, excessive sweats, chronic diarrhea, obstinate constipation, and pass much ill smelling flatters and stitch like pains through the piles. Then you have urinary symptoms, which is increased quantity of urine, pale white sediment, and has to rise several times at night to urinate. Glands of the neck enlarged and tender. So imagine a patient who lands to you with pathology. There are glands in the neck, in the abdomen, in the inguinal region swollen, and the reports show you that there is glandular involvement. Directly your mind, your thoughts should go to these nosodes or remedies which cause this swelling. Forget the symptoms for the moment, but you should keep the remedies in mind. When you ask the symptoms, you can find out what the totality is pointing towards, and then you see whether the nosodes will serve as intercurrent or they will serve as the whole one remedy only for the patient throughout its cycle of cure. You may require to give some other constitutional, especially deeper acting polycrest remedy, and then nosodes in between as an intercurrent, or the nosode as a total one remedy throughout its course of disease. Next we have tubercular inflammation of the knee, which we read. Great weakness, did not want to be disturbed, drowsy during the day, restless at night, many dreams, and flush of heat soon after the dose, some perspiration and severe headache in the head somewhere deep. So that brings us to the end of today's session of tuberculinum and bacillinum. There are smaller differences. Every homeopath has his own way of prescribing, has his own way of thinking, and you should do your own study and come up with your prescriptive pointers based upon your practice, your way of seeing patients, and about the related remedies. Probably in future, after we finish the Allen's keynote study streak, I would be starting a comparative study where you can join and learn about all these comparison of different remedies. So till then, till tomorrow rather, I would say 5 p.m. we'll meet tomorrow evening with a new set of remedies from the Allen's keynotes, and maybe in a week's time we will be able to finish the entire Allen's keynotes. So that's all for now, and see you soon tomorrow.